Good afternoon, everybody. I'm Sandra Arevalo from Montefiore Nyack Hospital. I'm the Director of Community Health and Wellness, and today we are doing community chats. Today we're going to be talking about rehabilitation. Yes, sometimes you might have a serious injury or a surgery or something that requires rehab. And a lot of us are not very aware of what rehab really entails, how is it done, is it painful, where can we go for this, either for ourselves or a family member. So today we're here with Vincent, and I'm going to say it in Italian, Chisari, because he just told me he's Italian. So I don't know if I say it right or wrong, but we're trying here. And he works at Burke, and he's going to be telling us everything about rehab. Vincent, thank you so much for being here with us today. It's been fun working with you for this webinar.
Thank you so much. It's great being here. Welcome, everyone. My name is Vinny Chisari, and I'm a therapist at Burke Rehab Hospital in White Plains, New York. Today, we're going to discuss the power of recovery. What is acute inpatient rehab? My slides didn't advance.
Can you see it?
Cross. You have to read up on yours.
Can you see the next one?
There it goes. Okay. Sorry. Post-acute care or rehabilitation includes rehab services that patients receive after a stay in a hospital. It's a type of intensive therapy program for individuals who have experienced a significant illness or injury and require intensive multidisciplinary rehabilitation to regain their independence. Depending on the intensity of care, the patient requires treatment. May include a stay in a facility, outpatient therapy, or home care. Post-acute care settings include inpatient rehab hospitals, long-term care hospitals, skilled nursing facilities, and home health agencies. So what is acute inpatient rehab, or IRF? We'll call it IRF. An IRF is an intensive, specialized form of rehab care delivered in a hospital setting to patients recovered from surgery, illness, or a medical event. This includes 24/7 daily nursing and physician care. Patients must be able to tolerate 3 hours of therapy. This includes physical therapy, occupational therapy, and or speech therapy. Treatment is delivered by a multidisciplinary team. So this is acute inpatient what is acute inpatient rehab? Sorry. It's the process of restoring function and independence to a patient. Focus areas are mobility, self-care, communication, cognitive function. The goal is to help patients return to daily life safely. Next slide. In this slide, we'll move from left to right. You can see that IRFs and long-term acute care hospitals manage the patients with the most complex needs at the highest level. An IRF is acute rehab. The highest level and a skilled nursing facility is subacute level of care. So there's a difference between acute and subacute. Next slide. When is rehab needed? Common conditions are stroke, brain or spinal cord injury, neurological disorders such as multiple sclerosis or Parkinson's disease, orthopedic surgeries such as hip, knee, or hip replacement, major traumas, or deconditioning. All patients must be medically stable to participate in therapy, to participate in this rehab. Next slide. So a patient must have a rehab diagnosis. In addition to what was mentioned in the previous slide, this also includes cardiopulmonary disorders, major multiple traumas like a car accident, musculoskeletal conditions, limb loss, amputations, or various neurological conditions. Next slide. A patient is medically screened and accepted on the following criteria. Clinically, a patient must have a medical complexity requiring physician care at least 3 times per week. The patient requires at least 2 types of therapy, PT, OT, or speech. A patient must be able to actively participate in 3 hours of therapy a day. This therapy is broken up over 3 separate sessions. It's not all at the same time. Everyone always asks, that sounds like a lot of therapy. You get like an hour in the morning, an hour at midday, an hour in the afternoon. So you do get time in between. It gets broken up, so it's not too intense. You get to rest in between. Patients must have a safe and reasonable discharge plan to the community, and Burke must accept the patient's insurance. Next slide. Okay. Some key features of IRFs. Daily physician visits. This is key because subacute rehabs do not always provide daily visits. This is extremely important. At least 3 hours of therapy, 5 days a week. Multidisciplinary teams such as PT, OT, speech, nursing, and social workers. And personalized recovery plans. Next slide. So what are the benefits of choosing an IRF? Better functional outcomes in skilled nursing or home health. Remember the multidisciplinary team. Increased chance of returning home independently. Lower 30-day hospital readmission rates and improved quality of life. Next screen. So why not just go home or to a nursing facility? Unlike nursing homes or home health, IRFs provide more therapy more often. Remember, 3 hours a day. Again, on-site 24/7 physician and nursing care. IRFs are designed for intensive recovery with daily access to multiple therapies and reduced rehospitalizations. Compared to other acute care providers, patients treated in inpatient rehab benefit from greater improvement in functional skills. They return home sooner, and IRF has a shorter average stay with longer treatment times when compared to a subacute or nursing facility who have longer stays with shorter treatment times. And increased independence, fewer medical complications, lower rates of admission to the hospital, improved quality of life. Patients return to their previous level of function more quickly than patients in other settings. I think I missed a slide. Here. How do you get into an IRF? Eligibility typically includes medical stability, need for multidisciplinary rehab, and potential to significantly improve function. So do patients have to meet special criteria to be admitted to an IRF? Yes. Both Medicare and insurance companies have specific criteria that patients must meet to qualify for this higher level of rehab. Under Medicare and private insurance guidelines, in order for a patient to be admitted to a rehab hospital, a hospital physician must certify that the patient needs this type of specialized intensive care. Next slide. So this is the beautiful campus at Burke, centrally located on 61 acres in White Plains, New York, not far away. We have 15 satellite outpatient locations throughout Westchester, Rockland County, Hudson Valley, and the Bronx. We are a 150-bed acute rehab hospital serving over 3,000 patients a year. I like to point out that Burke does offer free transportation from select Montefiore hospitals, such as Nyack Hospital, to Burke in White Plains 7 days a week. This is a really great offer from us. It really helps patients get from Rockland County to Westchester County. Patients love this. Let's watch a quick video tour of our facility. go. Great. That video is beautiful. I have to say, it's really nice to see the facility. It's a beautiful facility. They've even filmed movies there. I mean, it's just a gorgeous campus. Let's move on to our next slide. So let's take a closer look inside Burke. Here's an example of one of our rehab gyms at Burke. We have 5 gyms, one for each disability, and each one has specialized equipment for that diagnosis. For example, the cardiopulmonary gyms have more treadmills and recumbent bikes, whereas the neuro gyms have more body weight support treadmills and standing machines to help people walk again. Patient rooms are newly renovated, and as indicated in the video, we have semi-private and private rooms available. Okay, next slide. So in the Marsal Caregiver Center, patient, family, and friends will discover quiet rooms for rest or private conversation, access to caregiver resources, large spaces for group discussions, a conference room, a kitchenette stocked with coffee and tea, computer stations with internet access and charging stations, books and magazines, and assistance from a dedicated and licensed clinical social worker if needed. It's a great place to go if your loved one is in a gym in a rehab session and they don't want to sit in the room or the cafeteria and wait for them. They can go into the space and it's really nice. No employees are in there. It's just for caregivers. Next slide. So who are we? So Burke is a nationally recognized and accredited not-for-profit healthcare organization providing leading rehab treatment and research. Our mission is to provide the highest quality of medical care and rehab services to ensure that each patient achieves the maximum functional recovery from illness, injury, or disability. Our vision? To lead the field as the most effective and compassionate provider of practicing innovative treatment, clinical research, and inspiring education. Next slide. So what's the Burke difference? Our doctors provide advanced treatment and research in every setting, from inpatient hospital rehab to outpatient rehab. We are recognized as one of the nation's best rehab hospitals by U.S. News and World Report, now 3 years in a row. We just found that out this week, 3 years. We're very excited. We have among the highest number of rehab patients served in the country. Burke is accredited by CARF by demonstrating a commitment to the highest quality and innovative care. We care for more stroke patients than any other rehab facility in New York State. Next slide. So here's a list of rehab services we provide. As you can see, it's quite extensive. Some examples: amputee limb loss, brain injury, cardiac rehab, hemodialysis. This is unique to Burke. We're going to talk about this in the next slide. Neurological rehab, occupational therapy, physical therapy, speech therapy, orthopedic rehab, spinal cord injury, and stroke. Cover a lot. Next slide. So let's talk about hemodialysis. Hemodialysis, or HD, is a medical procedure that filters a patient's blood using a machine acting as an artificial kidney to remove waste products and excess fluid when the kidneys are unable to do so. This process is crucial for individuals with end-stage renal disease, kidney failure, or an acute kidney injury. Burke is the first and only freestanding inpatient rehab hospital in New York State with on-site HD. Before, post-acute patients with kidney and late-stage renal disease were admitted to a lower level of care for their rehab needs, or they had to travel to a third-party facility for the dialysis. Burke accepts established or new HD patients. So let's hear about a few patient success stories. First, we have Marlene.
I couldn't laugh, I couldn't smile, I couldn't speak. So here I am. You know, I give that to Burke. It's incredible how much I have progressed. Burke becomes family. You get really attached. You work hard. You work hard and you will succeed. This is not the final destination. You will continue and you live a good life.
Great story. Let's just look at one more. Let's check out Sandra's story.
One evening, and I was struck with the worst headache of my life. An AVM exploded in my head and had 2 brain surgeries, multiple angiograms, and was in a medically induced coma for 28 days.
Well, I chose Burke because weighing the other places that were available to us seemed to be the best. Well, my impression is it was wonderful and beautiful. And my mom was here a long time ago from a stroke rehabilitation.
And I got lovely treatment from these people. They were great.
They all have that feeling of they love their job, they want to be here.
I wanted to get back to being able to be a functioning, working mother, parent, wife. In my mind, I wanted to do it, but I just couldn't physically do it.
Every day was progress. With the therapy going on here, it was a big help. She had a full day schedule of different kind of therapies. The beauty of Burke's is they handle a brain injury and a physical injury. When you have a brain injury, your entire body goes from being in a coma, your whole body is limp. No muscle tone, no strength, no coordination, no hand to eye. Nothing works. It has to come back. And this is what Burke was able to do for her. Bring all this back. In a month's time, Sandra went from, she came in a gurney and walked out on her own.
Today, as I sit here talking to you, I can do a lot of what I previously did. I'm on the treadmill, I do my weights, everything I've ever done. I'm almost back to that, and I do thank this place for that.
Such great, inspiring stories. Very nice. It's great to hear the progress that these patients have made from such a low level to such a higher level. It's impressive. So Burke also provides neurologic music therapy. This is a very unique treatment for us. Music therapy is standardized interventions based upon a neuroscience research model. Music is hardwired in the brain, is a hardwired brain language. It addresses cognitive, sensory, and motor dysfunctions, aphasia, apraxia, dysarthria. It also addresses upper and lower extremities and gait training. Burke partners with MedRhythms Therapy to provide these services to our inpatients. Let's watch a few examples of Burke's music therapy in action.
I love you. I love you. There it is. I love you. Life of you. Don't rush it. I love you. I love you. Yes. All right, last time. I love you. Very nice. Wow. Say to me, you'll let me be your man. And please say to me, you'll let me hold your hand. I wanna hold your hand. I wanna move away. Okay, that was not.
All right. Very inspiring. Let's watch one more.
You got a cane. A cane, right?
Just fascinating. Every time I watch those videos, I'm amazed. I just can't get over it. It's just unbelievable. It's really great. All right. Let's move on to our next slide. So as you can see in these pictures, there are many activities to keep patients active and fully engaged in their rehab process. Rehab should be fun as well as therapeutic. It's a tough journey, but Burke will be there every step of the way to make the healing process a positive experience for each patient. The therapists are very engaging. They speak and make a very personal session when they're with you. So it really matters a lot to them. They want to make sure that their patients are happy. So this concludes our discussion. Thank you for watching today. My contact information is here if you have any questions about Burke or any other rehab needs. I appreciate your time today. Thank you.
Thank you, Vinny. This was great. I love the videos too, I have to say, because I mean, not only they show what really happens in rehab, but they're so inspiring too. You know, like I know that every therapist at work is working hard, but so are the patients. So I want to also give credit to all the patients because they have to put also their heart and effort into it. So it's great. Thank you for showing us that. And this is the time where our attendees would like to ask questions. So please use the chat, the Q&A. Let us know your questions. I'll be happy to read them to Vinny. And in the meantime, I have a few questions for you.
Great.
Who needs rehab? Does everybody need rehab after a surgery, or is it only after certain surgeries?
Well, anyone at any age with any diagnosis could be a candidate for rehab. Here at Burke, we take patients who are 15 years of age or older.
Mm-hmm. I've heard from some people who have gone through rehab, like for example, if they have knee surgery, things of that nature, they say that it's painful. What can you tell us about that?
Yeah, well, therapists tailor each therapy session with each patient specifically for their needs and safety. Sometimes, especially after a surgical procedure, the initial recovery period can be painful as you heal. However, we have 24/7 physician care who will work to reduce and optimize your pain management. Often you're given pain medication about an hour or so before you go into your therapy session to minimize the pain while you're participating in your recovery program.
Mm-hmm. And do you need to be hospitalized to receive the therapy, or are there ambulatory programs as well?
I'm sorry?
Do you need to be hospitalized to receive the therapy, or are there programs where you can just go for the day?
Well, there's inpatient rehab, which would be in the hospital, like the Burke main campus is inpatient rehab. We also have outpatient rehab facilities. We have 15 locations currently in the Rockland County, Westchester area, Bronx, Hudson Valley. And then there's home care, and they all provide different levels of care. So it all depends on the intensity that you're requiring in your therapy.
Mm-hmm. And what happens when you miss a therapy?
Well, it can happen. I mean, if you have a bad day, you don't feel like doing it, or you're tired. So you would just go to your next session and pick up where you left off. Our team of therapists will make up any missing therapy sessions throughout the week to maximize your time with us.
Mhm. Let's say that I don't know, I have sciatic pain or pain in my hips or my wrist. Can I just go to work and ask for therapy, or do I need a referral from a doctor?
You need a referral from a doctor. Here at Burke, if you wanted to come to we actually have an outpatient facility right on our main campus in White Plains. If you were coming from home, you would need to be evaluated by one of the doctors on staff first, and then they would determine if you're a candidate for outpatient rehab here at the main campus or at one of the other satellite locations.
Well, that sounds very interesting. And what type of doctors are they? Uh, is there a specialty or something, or is it general doctors?
They're physiatrists.
Ah, okay. So they are more for like the bones? Or...
Yes, they're more rehab based.
Okay, very good. You said that we can do therapy at home as well, because you said there is home care, right? So how does that work? It's like people go to your home and they do the therapy and they come back the next day?
Well, Burke doesn't provide home health care. What we would do is when the patient is ready for discharge, and the case managers will determine at discharge time what would be the next level for the patient. So if they're functioning great and they could just go home, they go home. If they're needing a little bit more rehab, sometimes they'll go to a subacute rehab, which is a one step down from acute rehab. They can go outpatient, or they can go to home health, have a home health aide come in, or a home health rehab. It all depends, but we don't participate in home rehab. We would refer that out to another outside source.
Okay. I think I know the answer. Go ahead.
No, and the case managers would handle all that directly with the patients.
Okay. And I was gonna say, I think I know the answer to this question, but does rehab have any disadvantages?
Disadvantages. Well, advantages are getting back to, or very close to your prior level of function. Disadvantages are not functioning as you did before the surgery or accident that make you require rehab. So I mean, disadvantages, it's not really. I mean, there's nothing really. I mean, as long as you participate in rehab, you're going to benefit. So,
And what about people who don't participate? Can you refuse therapy?
You can refuse therapy, but really you can refuse therapy, but it's not recommended. It's just not going to benefit the patients if they are refusing it. It's just you could say no, but why wouldn't you? I mean, I would think every patient would want to be getting the most care that they can at that time.
Now we know that Burke is great. I mean, we saw it in the video and all of that. I wouldn't doubt about that. But there might be people who are watching that cannot come to work for other reasons. What do we need to look for when we are choosing a good physical therapy or any type of rehab facility?
Well, if you're looking into a rehab facility, do your research online, check the facility's star rating. There is a Medicare website called carecompare.com, and it can give you outcomes of various rehab facilities in your area, and you can see who has the best reviews, outcomes, and star ratings. You can go visit the facility, set up a tour, and see what meets your needs. I mean, every facility is is going to give you a different feeling. Like I feel like when you're buying a house, when you walk into a new house, you know when it's yours. And I feel like if you go into a facility, you know if that's the right facility for you. You kind of feel it.
And now you just made me think of this. If you go to a facility and you start in that facility, but you don't like it for whatever reason, can you still change to another facility, or do you have to stick to that one until the end?
You could switch to another facility, but it's something that you'd have to discuss with your case manager first, because it has to also do with the insurance companies too and what they're covering. And
Yeah.
that's where it gets a little sticky, but I think it would be best to stay with one facility for a better continuity of care.
Yeah, so it's not only your choice, other factors affect that choice, like insurance, I guess, money, I guess.
Also, if the other facility could handle that patient's needs, I mean, certain facilities specialize in certain levels of care. So if you're getting one level of care that specializes in just say stroke care, you want to go to another facility, but that's not their strongest level of rehab, then why would you want to go there? I think you really need to focus on the facility that's going to give you the best kind of rehab for what your diagnosis is.
And Vinny, it's okay if you don't know the answer to this because it's a little specific, but as I was watching the video and seeing how large the campus is, do you know how many people are employed there?
I believe it's over 1,000.
Wow.
I believe it's over 1,000. And here at Burke, our hospital is broken up into specific units. So we have like a stroke unit, we have an orthopedic unit, we have a spinal cord injury unit, we have a brain injury unit. And in each unit, all of the patients have similar diagnoses. So the staff that's there taking care of the patients specialize in that diagnosis. So it's not like a general hospital where patients could be like mixed up and there's all different diagnoses and the rehab, the clinical staff, the doctors and nurses are treating all different diagnoses at the same time. When you're here, you're in a special unit and everyone in that unit knows exactly how to take care of you with that diagnosis. We make sure that patients are getting the highest level of care, whether it be rehab or their clinical care with their doctors and their nurses. We make sure that they get the exact amount of expertise that they require.
Wow, that's awesome. And I had another question in mind and they just started talking and it went away. But I remember now, do you also have group therapy?
Do we have group therapy? I'm trying to think. No, I think we just do individual sessions now. Outpatient will do some group therapy work, but inpatient here on the main campus, no, it's just individual.
Okay.
Currently.
Yeah, but if you have it for outpatients, that's great too, because then it's also like a socialization advantage.
Yes.
You're gonna go and meet other people that are going through the same. And that's when the question popped in my head, because you said, there are different specialties and different people are coming to specific units, then you're going to have the chance to meet with other people and you can exchange comments and be like, okay, it's okay. You're just starting. I've been here for X amount of months and I'm doing better. And they can encourage each other, right? So
yes. And also in the outpatient facilities, they're not at such a high level of care as they are when they're here inpatient. Mm-hmm. So it's a different kind of rehab that they're getting. I mean, it's similar, but it's not quite as intense in the outpatient, so that they can do a little more group work there.
Well, thank you so much for your presentation, for all your work, for answering all the questions. And I'm so looking forward to seeing you soon again. And thank you to all of our attendees. If you have any questions, feel free to reach out either to me, anyone from work, Vinny, of course. So thank you for being with us. And next week, we will be already in August. And on August 7, we are going to be talking about eating disorders. So don't miss that one. It's going to be very interesting. Thank you all so much. And I'll see you very soon. Bye-bye.
Thank you.